I was originally sent here over a workers' comp injury where I fell on a concrete floor and crushed 2 discs, my L45, L5S1, and had to have surgery on both of those. Then after that surgeon sent me here with Dr. Chu. And I was having issues where I was having to walk on a cane 24/7. I was having to be driven 95-98% of the time because my legs would give out. Mid-drive, I would just lose use of my legs. So my wife was having to take me everywhere. Like I said, I was on a cane or I had somebody under an arm a great deal of the time. It improved a little bit over time, but then I started having loss of my leg. I would just go numb out of nowhere, or if I had any kind of notice of it, it would be a 30-second notice. I'm like, I got to grab a seat quick. I'm falling. I fell. I can't tell you how many times, and the pain was usually a 7 out of 8, and it was stayed that way for years since 2010 up until November of 24 when I had the surgery. I had actually read a little bit about Spinal Stimulator, and I'd known a few people that had had it, and I've not known anyone who would tell me that they would not do it if they had that opportunity in the future or whatever. And so I was actually kind of excited about the opportunity to be able to do that, and I haven't regretted it, not a single second. It's crazy, but as far as when did I start seeing an impact or improvement, when I woke up from the surgery, it was night and day. There were no delays. There were no, well, give it a little bit, it'll help. Once they got everything honed in before I left the building, it was a completely different life. I only used my cane because I was afraid this wouldn't continue. It was just going to be a short, but it never stopped. Several people that I know that are in similar situations to what I was dealing with, various age from younger than I am to older than I am, and I've told every single one of them they need to get in touch with their general practitioner or their ortho or their neuro and talk to them about this to find out if it's an option, because if it's an option, I would absolutely recommend that they look into it and give it some consideration. It has truly been life-changing for me. I drove myself here today. That's not something that would happen in the past. I would have my wife sitting out in the vehicle waiting on me because I a lot of times couldn't trust my legs to get me here. If every doctor's office, if every physician, if every doctor was what you have here, life for millions of people would be different. Dr. Chu is just, what gets me is he looks like he's 22, but he's not. And he is so knowledgeable, so bedside friendly. Everybody here it's like they're waiting on you to get here that day. They take care of you one-on-one, and they are phenomenal. I wouldn't even consider going anywhere else as far as I'm concerned. Dr. Chu's he's my back specialist. I'm done.